Hello, welcome once again to Health Plug. Here we discuss everything about health, and I am Nanekia. Today we'll be discussing one of the very important diseases that actually affect the female reproductive system. It's so subtle in the sense that you might not notice that you are even affected by such disease. What I'm talking about today is pelvic inflammatory disease, or PID. So concerning this pelvic inflammatory disease, we'll be talking about the definition, we'll be discussing the causes, risk factors, signs and symptoms, complications, diagnostic methods, prevention, and treatment. Therefore, stay tuned. We'll be right back. PID is basically infection of the female reproductive system. This normally occurs when bacteria are able to intrude into the vagina through the cervix, into the uterus, into the fallopian tubes, and finally into the ovaries. Naturally, the cervix has its own way of protecting bacteria from entering into the vagina, but due to infection, these barrier cervix are one way or the other broken. Therefore, bacteria are able to invade the upper reproductive system of the female. Concerning causes of PID, it is necessary to understand that anytime the barrier created by the cervix is being disturbed, bacteria find their way into the vagina and into the reproductive tract of the female. Therefore, in the case of having unprotected sex, some bacteria, sexually transmitted bacteria, find their way into the reproductive tract in the case of gonorrhea and chlamydia infection. Secondly, in the case of childbirth, in the case of menstruation, and in the case of abortion or miscarriage. Then frequent douching, females that are into douching, that is washing of their vagina with water or other fluids. This process have its own way of introducing bacteria into the reproductive tract. And lastly, in the contraceptive use of IUD, during the process, some bacteria can enter into the reproductive tract. Those who are at risk of getting pelvic inflammatory disease include 1. Early sexual activities younger than age 25. That's female that started their sexual activities below the age of 25. Number 2, when you have a multiple sexual partners. Number 3, being in a sexual relationship with someone who has more than one sex partner. Number 4, having sex without using condom. Number 5, frequent douching. Number 6, a history of pelvic inflammatory diseases. And lastly, having a previous history of sexually transmitted infection. If you fall within this category, your risk of contracting pelvic inflammatory disease is very high. This disease may be asymptomatic in some women, meaning that some women may never show signs and symptoms. However, there could be signs and symptoms which might be mild and difficult to recognize. Some present signs and symptoms include there could be mild to severe lower abdominal pain or pelvic pain. Number 2, there could be unusual or heavy vaginal discharge that may present an unpleasant odor. The discharge may be yellowish or greenish. Number 3, there could be unusual bleeding from the vagina, especially during or after sex, and there can be bleeding to in between periods. There could be pain during sex. There is also fever or chills, painful, frequent or difficult urination, heavy or painful menstruation, and lastly, there could be nausea and vomiting. It is necessary to understand that the aforementioned symptoms can also be symptoms of sexually transmitted infection. Therefore, when these symptoms are noticed, it is essential to stop having sex and see your health provider. When prompt treatment is given to STIs, it can prevent every individual from getting pelvic inflammatory diseases. PID left untreated can form scar in the reproductive system, and this comes about with a lot of complication to the female, which include ectopic pregnancy. In the case of ectopic pregnancy, because of the scars that have been formed in the reproductive tract of the female, fertilized eggs are unable to propel from the fallopian tube to implant itself into the uterus. Secondly, there is a case of infertility. Infertility in the sense that even the eggs of the female cannot travel because of the scars in the reproductive tract. The female egg cannot travel from the fallopian tube into to fertilize the sperm that might come its way. Number 3 is there is chronic pelvic pain. And lastly, there could be tubal ovarian abscess. That is, there might be an abscess that's a pus formation in the reproductive tract of the female. Medically, there are a lot of ways to diagnose PID, which include 1, your medical history can be taken, which involves your general health and your sexual activity. Number 2, your signs and symptoms that you present can help us to ascertain that you have pelvic inflammatory diseases. And number 3, we can conduct a pelvic examination. Number 4, your blood sample can help us to know that you have the infection. And number 5, we can take your urinary test to rule out urinary tract infection. Number 6, ultrasound scan can be done to take an image of your reproductive system to help us to know where the infection is really at. And number 7, we have laparoscopy. And lastly, we can conduct endometrial biopsy. How to prevent PID include practicing safe sex by using a barrier method such as condoms and diaphragm. Number 2, you need to get tested to know whether you have any sexually transmitted infection. Number 3, you have to talk to your health provider to know about what contraceptive is best for you. And number 4, you have to request that your partner is also tested. Number 5, you need to avoid douching. And lastly, you have to seek prompt medical attention or prompt medical help when you notice any of the signs and symptoms. PID is usually treated using antibiotics. Therefore, it is very necessary to take all your medications even if you start to feel better after a few days. And it's essential to get your partner also treated to avoid reinfection. And lastly, it is necessary to temporarily abstain from sex until your treatment regimen is over. As mentioned earlier, the signs and symptoms of PID can also be the signs and symptoms of sexually transmitted infection. Therefore, it is necessary whenever you experience these signs and symptoms, please seek medical attention to prevent any future reoccurrence or future complication. This is the end of today's video talking about pelvic inflammatory disease. If you like my education, please don't forget to subscribe to our YouTube channel at Health Plug with Nanekia. Facebook is Health Plug with Nanekia. Don't forget to comment, don't forget to share, and don't forget to like our page. Thank you.